In our case study, our patient had fibromyalgia. Research is still being conducted regarding the etiology of fibromyalgia, but there are some factors that can be linked to this chronic pain disease. People with fibromyalgia may have inflammation in their brain due to the pain nerves being irritated or inflamed. Certain sections of their brain may even be smaller than what they should be. Also, the connections of the nerves in the brain may be faulty, causing pain nerves to sort of pause in communication, where a normal feeling of cold, pressure, or normal exercise feeling could feel extremely painful to a patient with fibromyalgia. Other possibilities that could cause fibromyalgia include genes, diseases, abuse, PTSD, gender, and inactivity. The fibromyalgia gene can be passed down through parents, or if someone has the gene for depression and or anxiety, they are more likely to have fibromyalgia as well, although this is not a direct cause. Other painful diseases, such as arthritis or some infections, can lead to fibromyalgia. If children were emotionally or physically abused when they were younger, the brain may change the way it handles pain or stress, leading to the development of fibromyalgia. There is also a link for fibromyalgia patients that are suffering from PTSD from a terrible event like a wreck, a war, or even rape. Studies show that this disease is more common in women than men, which may be because of how they feel and react to pain, and how society expects each gender to respond to pain. Lastly, fibromyalgia is more common in people that do not move enough throughout the day. Cannot stress this enough that exercise is one of the best treatments for fibromyalgia. Being active can help turn down a patient's pain volume. With the diagnosis of fibromyalgia, the patient goes into the doctor's office and tells them their symptoms and their types of pain, and then the doctor will perform a physical exam and observe those certain tender points on the body to rule out certain diseases that it could not be. They could use x-rays and blood tests to narrow it down, and if they don't have anything else, then they might have fibromyalgia. They really look at the pain and symptoms over the past week based on the total number of painful areas out of 19 parts of the body, plus the level of severity of these three symptoms: fatigue, walking or waking unfreshed, their cognitive problems like memory or thought, and then they also look at the general physical symptoms that the patient is suffering from. They'll also look at, do these symptoms last 3 or more months, and they really want to make sure that this patient doesn't have any other health problem that would explain these painful symptoms. The prevalence for fibromyalgia is extremely high in our country. It's at a 6.4% of citizens in the United States have fibromyalgia, which is the highest percentage of any country that this study showed. And the worldwide prevalence of fibromyalgia with general population is between 0.2% and 4.7%. But for women, the prevalence is 2.4% to 6.7%.